Hello, our friends. Today, we are talking about infective endocarditis. What is endocarditis? Endocarditis. It is an infection of the inner surface of the heart, usually the valves, mitral valve, followed by the aortic valve. We have many types of endocarditis. Today, we focus on some types. Acute bacterial endocarditis. Subacute bacterial endocarditis. Prosthetic valve endocarditis. Rheumatic carditis.
Hello, I'm the Hartwell. At least I used to be strong and steady. But now, I'm under attack. You see, I've been invaded by a nasty bacteria called Streptococcus pyogenes. It all started when some bacteria entered the bloodstream, maybe from a skin infection, and decided to make my aortic valve their new home. Now, I'm inflamed, feverish, and struggling to function. The bacteria have formed these clumps called vegetations on my valve. My owner, Yusuf, is in the emergency room with a high fever, chills, and fatigue. The doctors are rushing to treat me with strong IV antibiotics, but this infection is spreading fast. I'm a case of acute endocarditis, and I need help before it's too late, developing in days to weeks. If Yusuf doesn't get treated quickly, I could fail, or worse, pieces of these vegetations could break off and travel to other organs, causing even more damage.
Symptoms: signs of endocarditis, tachycardia, short of breath, chest pain, fatigue, fever, bacteremia.
Hello, I'm a case of subacute endocarditis, and while it's not as rapid as the acute form, it's still dangerous. I'm the heart, fighting a slow battle against subacute endocarditis. I've been invaded by Streptococcus viridans, likely from a dental procedure, which settled on my damaged mitral valve. My owner, Sarah, has subtle symptoms: fatigue, low-grade fever, and night sweats. Clumps called vegetations are shielding the bacteria, making treatment tricky. If untreated, these vegetations could break off and damage other organs. Please, take care of your heart, especially if you have valve issues, and don't ignore persistent symptoms. Early detection can save us both. Mechanisms of infection. The condition typically arises when bacteria enter the bloodstream, often through dental procedures or skin infections, and subsequently colonize damaged heart valves. Furthermore, conditions such as rheumatic heart disease and congenital heart defects predispose to subacute bacterial endocarditis. Selected bacteria cause subacute bacterial endocarditis. Streptococcus viridans, Enterococcus, Streptococcus bovis, associated with malignancy, Escherichia coli. Diagnosis. Blood cultures are the cornerstone for identification of the causative microorganisms, with Streptococcus viridans being a common pathogen associated with subacute bacterial endocarditis. Prosthetic valve endocarditis. Staph. Epidermidis S. Epidermidis is part of the normal flora of the skin and anterior nares, important cause of device-related infections such as prosthetic implants or heart valves and catheters. Bacterial myocarditis can be caused by several bacteria including Staphylococcus and Streptococcus, which might also lead to pericarditis. Other bacteria that can contribute to this condition are Corynebacterium diphtheriae, Borrelia burgdorferi associated with Lyme disease, Mycobacterium tuberculosis, Mycoplasma, and Treponema pallidum, cause of syphilis. Culture-negative endocarditis is a condition where the infectious agent has not been identified through culture or is not known. This can include slow-growing, fungal infection, viral infections, unusual organisms including chlamydia, Brucella, and L-form bacteria. Blood culture was done after antibiotic therapy. Vegetations also form roughened spots on the endocardium that provide places for bacteria to lodge and grow, producing additional layers of vegetations. Fragments of vegetations and blood clots, each called an embolus, can break off and travel via the blood to lodge in small blood vessels of many organs.
Hello, I'm the heart, and I'm under attack not by bacteria this time, but by a virus. It's called viral myocarditis, and it's causing inflammation in my muscle tissue, making it harder for me to pump blood effectively. My owner, Noha, recently had a flu-like illness, and now she's feeling weak, short of breath, and her heart rhythm is off. The virus possibly has triggered an immune response that's damaging my cells. Noha's doctors are treating her with supportive care, but if the inflammation isn't controlled, it could lead to long-term damage or heart failure. Please, take viral infections seriously, rest, and seek care if you notice unusual fatigue or heart symptoms after being sick. Selected viral pathogens. Enteroviruses including Coxsackie B and echoviruses, Epstein, Barr virus, cytomegalovirus, parvovirus B. Herpes virus 6, influenza, hemorrhagic fever viruses, hepatitis C virus, adenovirus, rubella, human immunodeficiency virus. Fungal pericarditis is a rare but serious condition where the pericardium, the protective sac around the heart, becomes inflamed due to a fungal infection. It typically occurs in individuals with weakened immune systems, such as those with HIV, AIDS, cancer, or those on immunosuppressive therapy. Common fungal pathogens include Candida species E. G. Candida albicans. Aspergillus species. Histoplasma capsulatum, common in endemic areas like the Ohio and Mississippi River valleys. Cryptococcus neoformans. Cardiomyopathy. Cardiomyopathy refers to progressive impairment of the structure and function of the muscular walls of the heart chambers. Most common causes of dilated cardiomyopathy are Coxsackie B virus is the most common cause of viral cardiomyopathy. HIV herpes virus type 6. Dear students, as we wrap up our discussion on infective endocarditis, I support you to pay close attention to this critical condition. Study hard and be ready for the exam. Al salam alaikum.